You're watching Young Turks on CNBC TV 18. It's time now to head across to Mumbai. Join Delano D'Souza. He's standing by with his young achiever.
Well, Shireen, he's gone from Mumbai to Jacksonville, Florida. On Young Turks this week, I catch up with world-renowned ophthalmologist Dr. Gulani. When he is not lecturing in far-flung corners of the world or operating out of his base in Florida, Dr. Gulani spends his time with his father in Mumbai, reminiscing of his days as a resident intern at KEM Hospital. His career has not seen as many twists and turns as it has highs. He remains as optimistic now as he did while making the transition to the US as an immigrant doctor.
The challenge is more mental than physical because number one, where I was coming from, I already had a bright future here, but what I realized is if you're good in what you do, things follow. And the only big hurdle we had was I had to repeat my entire residency of 4 years. So barring that, I decided to be the best in what I can do. And then when I started my practice, I just started seeing things happening in a positive cycle.
You started your institute in Florida, the Gulani Vision Institute. So how did that come about? Were you always passionate about teaching?
I started as the head of cornea and LASIK at University of Florida, and I realized you got to put your money where your mouth is. I believed in the fact that I had a passion to make people see. Doctors were already traveling to learn my techniques, and I had a constant desire to innovate, to take ophthalmology more and more further, LASIK in particular. And that made me put everything I had in my life into my institute, the Gulani Vision Institute in Jacksonville, Florida.
And what was your investment like? Were you a sole investor?
We did have a number of people who came forward for investment, but I just decided to do it alone.
In his state-of-the-art institute in Jacksonville, Florida, Arun shares his knowledge in the field of ophthalmology. But what about coming home?
I've had a number of renowned physicians here in India as well as hospitals who approached me. I already do have patients who seek my consultation. Those who can afford can even come up to me in Jacksonville. So I've kept it open. Once I do find the right place and timing, I do not mind coming down maybe twice a year and surely collaborating.
Are you taking Indian surgeons there to get trained under you?
Yes. Among the surgeons that come to train under me, I do also involve Indian surgeons, and many Indian eye surgeons have been to me trained, and I've come back here and are doing excellent work.
Your dream, I read, was to create entirely artificial eyes for the blind. Do you think science will ever let that happen?
I never say never. It obviously will happen because the first step towards science fiction is already taken when I did among the first few artificial corneas. Artificial cornea, again, just the word itself tells you it's an artificial synthetic material replacing the human cornea. What's left, according to me, is someone to, and there are many people working on this, is an artificial retina. Once that happens, it'll be pretty much common sense to put it together.
Have you set a time frame for yourself?
Retina is not my field. My field is cornea, anterior segment, but I think in the next decade we should see leaps and bounds in this research and innovation because people are working on it fervently right now.
A lot of Americans right now are coming to India to get treated. It's medical tourism. It's obviously cheaper in India. It's faster, a lot quicker. You know how in America there's so much with insurance and waiting around for these procedures to be done. Would you ever see yourself coming back to facilitate this growth?
I've kept that avenue totally open, bilaterally in fact. And what that's going to do, the decisive factor for me is a matter of timing. Meaning when I do feel that the timing's right, the place is right, and I can physically be in two places, making sure that the quality of care which I'm known for stays the same.